If you're over 60 and you wake up tired, snore like a chainsaw, or need a nap just to get through the day, it's probably not just poor sleep or age. Sleep specialists in Australia now warn that up to half of older adults with insomnia-like symptoms actually have undiagnosed sleep apnea, a silent nighttime choking that raises your risk of heart attack, stroke, dementia, and deadly car crashes. Today, you'll learn the 7 bad nights older Australians brush off as normal that actually scream sleep apnea, and the simple steps to test, treat, and finally wake up feeling alive again.
The silent sleep crisis sweeping older Australia year after year. The same complaint echoes through GP surgeries, aged care facilities, and family homes across Australia. I just don't sleep like I used to. You toss and turn. You wake up multiple times. You drag yourself out of bed feeling exhausted. You're foggy, irritable, and struggling to stay awake during the day. Most people blame stress, age, too much caffeine, or just being a light sleeper. But Australian cardiologists, neurologists, and sleep physicians are sounding the alarm. A huge proportion of bad sleep complaints in people over 60 are actually undiagnosed sleep apnea. That means every night, without even realizing it, your breathing stops over and over again. Your oxygen drops. Your heart races and slows erratically. Your brain jolts into micro-wakefulness. The result? Even if you're in bed for 7 to 8 hours, you wake up feeling like you've been hit by a truck. Sleep apnea isn't just snoring and daytime drowsiness. In people over 60, untreated sleep apnea massively increases heart attack and stroke risk, makes high blood pressure almost impossible to control, accelerates memory loss and dementia, is linked to depression, anxiety, and mood swings, multiplies car accident risk, especially dangerous for older drivers across Australia. Hundreds of thousands of older adults are living with labels like insomnia, chronic fatigue, forgetfulness, or even depression, when the real culprit, obstructive sleep apnea, has never been tested for. This video exists to shine a light on that silent crisis. What is sleep apnea? In plain English, sleep apnea means your breathing repeatedly stops while you sleep. There are 2 main types: obstructive sleep apnea, OSA, the soft tissues at the back of your throat, tongue, soft palate, surrounding muscles, collapse during sleep, blocking your airway. Your chest and belly keep trying to breathe, but no gets through. Central sleep apnea, your brain temporarily stops sending the breathe signal. This is less common and more often seen in people with heart failure or certain neurological conditions. Both lead to the same outcome. Your breathing stops for 10 seconds or longer. Your oxygen level drops, your brain detects the problem and jolts you into partial wakefulness. Sometimes you snort or gasp. Sometimes you don't even remember it. This cycle repeats dozens or even hundreds of times per night, so the problem with sleep apnea isn't just sleeping less. It's that your sleep quality is utterly destroyed. Your brain, heart, and blood vessels are in fight-or-flight mode all night. No wonder you feel terrible in the morning. Why sleep apnea gets worse after 55 to 60? Several age-related changes make sleep apnea much more likely after 60. Fat accumulation around the neck, tongue, and throat. Weight gain and changes in body composition narrow the airway, loss of muscle tone. Throat muscles naturally weaken with age, making the airway more likely to collapse. Hormonal changes, especially in postmenopausal women. Sleep apnea, once thought to be mostly a male problem, becomes far more common. Nasal and upper airway problems. Years of allergies, nasal polyps, deviated septum catch up with your heart, vascular and kidney disease. Fluid balance disruption can cause fluid to shift to the neck area. Overnight medications, sedatives, muscle relaxants, some sleeping pills, alcohol, or relax throat muscles further. So what gets dismissed as "I'm getting older, I sleep less" can actually be your airway collapsing repeatedly every single night. The 7 insomnia patterns that are actually sleep apnea. Many older Australians think sleep apnea only affects young, obese men who snore like freight trains. But the reality is very different. Older women, in particular, often present with, "I wake up all night and can't get back to sleep. I have a headache every morning and my mouth is dry. I'm irritable, forgetful, anxious during the day, but I don't snore, so it can't be apnea. This is the most dangerous misconception. Sleep apnea doesn't always involve loud snoring. In some people, especially women and slimmer individuals, it presents more quietly, with microarousals and fragmented sleep that looks exactly like insomnia or anxiety. In this video, you'll learn the 7 specific bad night patterns that signal sleep apnea: waking up feeling like you didn't sleep at all, dozing off during the day, in front of the TV, on the bus, even while driving, your partner reporting you snore, gasp, or stop breathing at night, morning headaches, and dry mouth, waking to urinate multiple times. But the real cause is heart apnea, not just your bladder. Hard to control, high blood pressure and irregular heartbeat, worsening memory, concentration, and mood. Over recent years, each of these can seem harmless on its own. But if you have several of them together, it's time to ask, do I need a sleep apnea test? Why this is so serious: impact on heart, brain, and lifespan. When sleep apnea goes untreated, heart, repeated oxygen drops and adrenaline surges overnight drive high blood pressure, heart rhythm disorders, especially atrial fibrillation, and heart attack risk sky high. Brain, fragmented sleep damages the hippocampus, memory center, accelerates dementia risk, and worsens existing cognitive decline. Metabolism, insulin resistance, weight gain, worsening diabetes control. Mental health, depression, anxiety, irritability. Accident risk, daytime alertness plummets, driving becomes dangerous. Sleep apnea doesn't just ruin your nights, it systematically weighs down your heart and brain health during the day. Roadmap for this video: Part 1. This section, intro. You now understand what sleep apnea is, why it's so common after 55 to 60, and the risks of dismissing it as just poor sleep. Part 2, body. The 7 warning signs. In the next section, we'll walk through the 7 specific night and day patterns one by one, what they look like, what's happening in your body, which serious conditions they signal, and when to seek help urgently. Part 3, conclusion. Your action plan. In the final section, you'll get step-by-step guidance, home screening questions, what to say to your GP, which tests to request, home sleep study, lab polysomnography, CPAP and alternative treatments, weight and lifestyle changes, sleep hygiene tips, and safe driving advice. Part 2, body. The 7 bad night warnings older Australians ignore. Warning number 1. Waking up feeling like you didn't sleep at all. What it looks and feels like: you've been in bed for 7 or 8 hours. The alarm goes off. You feel like a rock, heavy, foggy, utterly exhausted. It's not just the normal grogginess that clears after a few minutes. It's a deep, relentless tiredness that follows you all day. What's happening inside your body? Hundreds of microarousals overnight prevent your brain from reaching deep sleep and REM, rapid eye movement. Sleep. The stage is essential for physical repair, memory consolidation, and hormone regulation. Even though you're asleep in the sense of lying still with your eyes closed, your brain never truly rests. Key clues: it's serious. Exhaustion is every morning, not just after late night or stressful day, paired with morning headache and dry mouth. Family members notice you look wiped out all the time. What to do? Track how you feel each morning for a week. If unrefreshing sleep is consistent, book a GP appointment and mention sleep apnea screening. Warning number 2. Dozing off during the day, TV, bus, car, what it looks and feels like. You're watching the news and your eyes start closing. You're reading a book and the same sentence blurs over and over. You're sitting in a waiting room and you catch yourself nodding off. Worst of all, you're driving and your eyes feel unbearably heavy, even just for a second, a red light or on the motorway. What's happening inside? Your sleep debt has become so severe that your brain is forcing microsleeps, brief, involuntary episodes of sleep that can happen even when you're trying to stay awake. This is extremely dangerous, especially behind the wheel. Key clues: it's serious. You doze off in passive situations, watching TV, as a passenger, in active situations, driving, talking. You've had near-miss accidents or been told you fell asleep mid-conversation. Your Epworth Sleep in a Scale score, a standard sleep medicine questionnaire, is high. What to do? This is urgent. See your GP within days. Request sleep apnea assessment. If you're dozing while driving, Stop driving until assessed. Warning number 3. Snoring, gasping, choking sounds reported by your partner what it looks and feels like. Your spouse or partner says, "You snore so loud I have to sleep in another room." I hear you stop breathing, then gasp like you're choking. You jerk awake snorting for air. Sometimes you wake yourself up with a loud snort or feeling like you're suffocating. What's happening inside? This is the classic triad of obstructive sleep apnea: snoring, airway narrowing, apneas, complete blockage, and arousal gasps, your brain forcing you to breathe again. Key clues: it's serious. Snoring is loud enough to be heard through walls, breathing pauses, or witnessed by another person. You wake choking or gasping multiple times per night. What to do? GP appointment within the week. Ask your partner to come with you or write down what they observe. Request referral for sleep study. Warning number 4. Morning headaches, DIY mouth, and frequent nighttime urination. What it looks and feels like. You wake with a tight, pressing headache around your head or the back of your neck. Your tongue and throat are bone dry, like you've been breathing through your mouth all night. You get up to urinate 2 to 3 times, disrupting your sleep further. What's happening inside? Oxygen drops cause blood vessels in the brain to dilate and co-balance to shift, triggering headaches. Dry mouth is a sign of mouth breathing and snoring. Frequent urination can be the heart and kidneys responding to repeated oxygen desaturations, not just an overactive bladder or prostate issue. Key clues: it's serious. Headaches are most mornings and improve as the day goes on. Dry mouth is severe. You wake needing water desperately. Nighttime urination is new or worsening, especially if paired with daytime sleepiness. What to do? GP appointment. Request sleep and cardiac assessment. Don't assume it's just my bladder or just tension headaches. Warning number 5. Hard to control high blood pressure and heart palpitations. What it looks and feels like. Your GP has you on 2 or 3 different blood pressure medications, but your readings are still high, especially in the morning or overnight. You wake with your heart racing or pounding. You feel irregular heartbeats or skip beats. What's happening inside? Repeated oxygen drops overnight activate your sympathetic nervous system, fight or flight, which constricts blood vessels and drives blood pressure up chronically. Sleep apnea is also strongly linked to atrial fibrillation and other arrhythmias. Key clues: it's serious. Blood pressure is resistant to medication. You have new or worsening heart rhythm problems. Your cardiologist says your heart looks okay structurally, but something's triggering these issues. What to do? Tell your GP and cardiologist you want to be screened for sleep apnea. Many cardiologists now routinely check for it in patients with resistant hypertension or atrial fibrillation. Warning number 6. Worsening memory, concentration, and mood over recent years. What it looks and feels like. You forget appointments, names, recent conversations more than you used to. You struggle to focus even on simple tasks. You're more irritable, impatient, short-tempered. You feel foggy most of the time. Family members say you've changed. You're not yourself. What's happening inside? Chronic sleep fragmentation and oxygen desaturation damage the hippocampus, brain's memory center, and prefrontal cortex, planning, judgment, emotional regulation. Studies show sleep apnea accelerates cognitive decline and is linked to higher rates of depression and anxiety. Key clues: it's serious. Cognitive and mood changes have been gradual but noticeable over 1 to 2 years. You're also experiencing other sleep apnea signs: snoring, tiredness, headaches. Your doctor is considering dementia or depression without investigating sleep. What to do? Insist on sleep apnea screening before accepting a dementia or depression diagnosis. Treating apnea can dramatically improve memory and mood in many people. Warning number 7. Waking at night with panic, choking sensation, chest tightness. What it looks and feels like. You suddenly wake in the middle of the night feeling like you can't breathe. Your chest is tight. Your heart is pounding. It feels like a panic attack. It's terrifying. Your partner says you looked blue or gray, or that you were making choking sounds. What's happening inside? These are not panic attacks or nightmares. They're severe oxygen desaturation events. Your airway has completely blocked, oxygen has dropped dangerously low, and your brain has forced an emergency arousal. If you have existing heart disease, this combination of hypoxia plus adrenaline surge can trigger dangerous arrhythmias. Key clues: it's urgent. Episodes happen multiple times per week. You feel chest pain, irregular heartbeat, or extreme breathlessness. Your partner reports you stop breathing or turn blue. What to do? Emergency assessment if chest pain is severe or doesn't resolve. Otherwise, urgent GP appointment within 24 to 48 hours. This pattern needs immediate sleep study referral. Part 3. Conclusion. Your sleep apnea action plan. Step 1. Home screening. 7 questions to ask yourself. Do I wake up feeling unrefreshed most mornings? Do I doze off during the day while watching TV, reading, or even driving? Has my partner noticed snoring, gasping, or breathing pauses at night? Do I have morning headaches and dry mouth regularly? Is my blood pressure hard to control despite medication? Have I noticed worsening memory, focus, or mood over the past year? Have I woken at night feeling like I'm choking or can't breathe? If you answer yes to 3 or more, you should pursue professional sleep apnea assessment. Step 2. What to say to your GP. Be clear and direct. I've been waking up exhausted and falling asleep during the day. My partner says I snore and stop breathing at night. I'm concerned about sleep apnea and I'd like to be referred for a sleep study. Ask your GP for sleep apnea screening questionnaires, Epworth Sleepiness Scale, Stop Bang, referral for home sleep study, portable device, or lab-based polysomnography if high risk, direct referral to sleep physician. Step 3. Understanding sleep tests. Home sleep study, portable monitor, small device with nasal airflow sensor, chest abdominal belts, finger oxygen probe. You sleep in your own bed. Device records breathing, oxygen, heart rate, snoring. Cheaper, more accessible, but doesn't measure brain waves or sleep stages in detail. Polysomnography, full sleep lab study, overnight stay in a sleep center with electrodes monitoring brain waves, eye movements, muscle tone, heart rhythm, breathing effort, oxygen, leg movements. Gold standard, most detailed and accurate, essential for complex cases or if home study is inconclusive. Step 4. Treatment options after diagnosis. 1. CPAP, continuous positive airway pressure, nasal or full face mask, delivers gentle pressurized air overnight, keeps airway open, stops apnea events, prevents oxygen drops, takes a few weeks to adjust, but with correct mask and pressure settings, most users report life-changing improvement. 2. Oral appliances, mandibular advancement devices, custom fitted by a dentist, holds lower jaw forward to open airway, good for mild moderate apnea or people who can't tolerate CPAP. 3. Weight loss and lifestyle changes, losing even 5 to 10% body weight can significantly reduce apnea severity. Avoid alcohol, especially evenings. Quit smoking. Review sedative medications. 4. Positional therapy, some people only have apnea when sleeping on their back. Special pillows, shirts, or devices can train you to sleep on your side. 5. Surgery for structural problems, enlarged tonsils, nasal blockage, severe soft palate excess, less commonly recommended in older adults. CPAP usually safer and more effective. Step 5. CPAP tips for success. Mask fit is critical. Try nasal masks, nasal pillows, or full face masks. Find what's comfortable. Gradual acclimatization. Wear the mask during the day for short periods before sleeping with the humidity and heat settings. Adjust to prevent dry nose and throat. Regular follow-up. Your sleep clinic will check device data to ensure apnea is controlled and you're using it enough hours per night. Most patients report within weeks. Waking refreshed. Daytime sleepiness gone. Better mood and concentration. Blood pressure and blood sugar easier to control. Step 6. Daily habits to support treatment. Weight management. Even modest weight loss helps. Limit alcohol, especially evenings. Alcohol relaxes throat muscles. Sleep on your side, not your back. Keep regular sleep schedule, same bedtime and wake time. Daily cut caffeine after midday. Avoid long daytime naps. Short 20 to 30-minute power naps only. Step 7. Benefits for heart, brain, and dementia. Risk when sleep apnea is treated. Blood pressure becomes easier to control. Heart rhythm problems, like atrial fibrillation, occur less often. Memory, attention, and mood improve. Depression and anxiety symptoms often lessen. Long-term dementia risk decreases. CPAP isn't just a snoring device. It's a nighttime life support system for your heart and brain. Step 8. When to seek urgent help. Severe chest pain, extreme breathlessness, or can't breathe at night. Call ambulance falling asleep at the wheel multiple times. Stop driving immediately and seek urgent assessment. CPAP causes severe discomfort or breathing difficulty. Contact your sleep clinic for urgent mask pressure adjustment. Step 9. Talk to your family. It's teamwork, not shame. Sleep apnea is usually noticed by partners first. So, don't take "you snore" as a personal attack. It's a health warning. Ask family for honest feedback about your nighttime behavior. Bring your partner to the GP appointment so they can describe what they observe. Remember, the goal isn't to label you the loud snorer. It's to protect your heart and brain. Step 10. Remember, bad sleep isn't normal at any age. Saying "my sleep is bad" that's just what happens when you get older is as dangerous as saying high blood pressure is normal for all people. Nothing you can do. If you're 55, 60 plus and you wake up tired every day, can't stay awake during the day, snore, or stop breathing at night, have blood pressure, heart, or memory issues, this isn't just poor sleep. It's your body screaming, "I'm suffocating at night. Help me." Sleep apnea can be tested, treated, and in most cases, dramatically improved. Fixing your nights can save your days and your life.